Hello, parents, and welcome to our virtual Pediatric Campfire chat, brought to you by Crystal Run Healthcare. As pediatricians and parents ourselves, we created this series to open a dialogue to provide education and answers on a variety of topics we know have been weighing on your minds throughout the COVID-19 pandemic. Your Crystal Run pediatrician is a trusted advisor during these difficult times. So sit back, get cozy, and get ready to chat. Good afternoon, everyone, and welcome back to our weekly Crystal Run Campfire chat series. We're actually on location today. You can see I got special access to Yankee Stadium, a place that I'd like to be back again in the distant future when things are a little settled down. And I'm delighted to introduce a special guest that we have today. We're going a little bit off our typical topic, but I have Dr. Justin Conway with us. And I'll let Justin introduce himself in a moment, but just to briefly let everyone know again that this is a webinar today. For those that are listening at home, feel free to submit questions to us. This is a live broadcast, so you never know what might happen. But if you have questions along the way, we'll try to answer them in real time and be happy to hopefully cover a lot of topics related to returning to sports. So Dr. Conway is a sports medicine physician with us. He's an honorary pediatrician because he sees many of our patients. And he also has helped me. He helped me to the starting line of an important race last year, so I thank him for that. And he's been a great resource for us and our patients at Crystal Run. And so Justin, why don't you go ahead and introduce yourselves? And as is our custom on the show, I'd love for you to share with our listeners what you've been doing during this shelter at home time over the last several months.
Great. Well, thank you for allowing me to participate in the chat. Excited to be here. You're going to hopefully have some fun. So I'm a family physician first and foremost, with then additional training in sports medicine. So with the family medicine background, it sets me up well to treat all ages, from kids to adults of any age. I fell in love with sports growing up in New Mexico, where I'm from. Played every sport I could. And that led to then playing basketball at the collegiate level at Princeton University before going off to medical school. And I feel lucky to be able to have kind of folded my love of sports and love of just all the energy around team sports and, just staying active in general into my day job, where I get to kind of see athletes of all ages. And in particular, here in my work at Crystal Run, I get to be the team physician for Mount St. Mary College, which is a local Division III college in Newburgh, New York. I also help out with Marist College Athletics up in Poughkeepsie. And then as well, I'm a volunteer for the U.S. ski and snowboard team, part of their medical physician pool, which is a fun little side gig when I have a chance to do that. So that's a little bit about what I'm up to.
Great. And Justin, what have you been doing during this last months?
So I've been, thankfully, I feel fortunate to be in a position where I'm still working and have a job and being able to continue that. I also have two young kids at home. I have a daughter who's almost 4 and a son, Trevor, who's just turned 1. My daughter's name is Louise. So we're just kind of starting out and figuring out what to. And it's been a lot of fun, crazy at times, but we're really happy.
Great. That's great. Well, wonderful. So the reason we're going to talk about sports today is that over the last 6 weeks of this series, we've actually gotten a fair number of questions from parents. And in my practice in pediatrics, I've had the same about safely returning to sports. Before talking about that, I'd like to just kick off each show with a brief overview of where we are locally in terms of our return in general and what's going on with COVID. And this past week has been in the news in some ways because there's been an announcement finally about school reopening. So it's been pretty much the same in the Hudson Valley over the last week as it has been in the last 6 weeks, although we're all continuing to watch closely for a resurgence of cases based on what's going on around the country. In the region in the last several days, the positive testing rate has hovered right around 1 to 1.5%. And the reason that I share that is that's an important number as we think about returning to school and returning to sports. And Governor Cuomo announced this week the plan for schools reopening, and that number of percentage of positive tests is being used as a marker of a safe return to school. And the threshold for returning to school in person is less than 5%. So we're currently there now. There's still a long way to go for schools to figure out exactly how to send everybody back safely and to do that in a way that they can do so in person. But I think the important news this past week was at least defining a threshold for doing so. So that's where we're at. My message is the same this week as in past weeks. Continue to be vigilant and careful. There have occasionally over the last week been a couple of days where we've seen a little bit of a mini surge of cases again. And so we do encourage and thank everyone for being careful during this last several months, but continue to encourage you to do so. So with that being said, just to kick things off, Dr. Conway, what's the current thinking right now about safeties with respect specifically to COVID and returning to sports in general? And what are you hearing about from parents and also from teams and from your background about just in general what the risk is with COVID and how to potentially reduce some of those risks as we all think about returning to sports?
Yeah, it's a great question. I think as with anything in our society, in these times, it's a balance of, the risk and reward, I guess, of going back to how things were or trying to approach that. So, with sports in particular, there's obviously a lot of great benefits, both physically and mentally, to sports and athletics. And, we want, especially our youth, to get back to that for a lot of reasons. But obviously, there's risks of spread of the virus and other infectious disease as well that need to be taken into consideration. So I think, one thing that there's a lot of discussion about is risk stratification. So obviously, there's a spectrum. So maybe on one side you have a sport like golf or tennis where it's individual, it's like naturally socially distanced. And then on the other spectrum, maybe wrestling where there's sweat, blood, and tears like that's inherent to the sport. So trying to, risk stratify, figure out, what are the thresholds in your community to return safely to sports, and then what does that look like in terms of what sports maybe would be less risky. Certainly outdoor sports better than indoor sports, individual better than team in some circumstances, and then a lot of discussion on what protocols need to be in place to make sure, in terms of screening and symptom checklists and things like that, so that once we do go back, we don't immediately have to shut it down because there's a spike or an outbreak in that setting.
Great. So, this time of year, typically the teams are starting to gather up again for the fall sports. And so maybe we can just talk specifically about where we are with some of those as far as the risk and what you're hearing. So, a lot of times this is soccer, football are the two of the big fall sports that are coming back. And, both obviously girls and boys soccer are big time. This is the time of year for the school teams to be getting ready. What are the where are we with soccer and football, two common sports that we're thinking about this time of year, and what are your thoughts on the risks of those two sports?
Yeah, I mean, unfortunately, football definitely is riskier than soccer for various reasons. There's obviously soccer in contact, but more in football. Football is also much bigger teams, so this right there, that's a bigger risk. Not to say that football can't happen, but I think that soccer seems more likely to be able to be done I think there's a better chance, I guess, that we have a soccer season than a football season, but I hope that we have both. I think with also, the MLS has started to get back to some games, so that's encouraging as a model. I know, in my work with Mount St. Mary College, we've been talking a lot just the past couple weeks about what return to school and sports are going to look like. And right now, the college is inviting all their students back on campus. So our thinking is that if the students are going to be back on campus anyways, then it would make sense to try and allow them to participate in sports. I think, in terms of youth and high school sports, usually, the kind of thinking is, well, if you're going to be allowed to play sports, you need to be in school because obviously you're a student first and then an athlete. With schools, and kind of best case scenario being like, at a reduced schedule in terms of in-person learning, I would argue that, organized sports is even more important potentially than normal to like give kids a chance to socialize and let off steam. So I really think we need to do everything we can to make that possible.
Great. Yeah, I think one of the things that I'm hearing from a lot of parents is that some of the non-school teams, the travel teams that sometimes are playing in the summer, are starting to have practices again. And I was just talking with a parent today that was telling me about some of the protocols that are in place. And this is a sort of a young teenager. In terms of parents have to stay in the car and no one can be sick and they have to fill out a screening checklist. I think we're used to a lot of those right now. But what is what are some of the safety measures for the kids in terms of as these teams are coming back together beyond just making sure that you arrive without any symptoms? How do teams practice safely? How can they replicate sort of the activities that a team sport might do in this current sort of setting?
Yeah, so definitely something we're figuring out. But so obviously we need to, students and parents need to be honest about their symptoms and potential exposures. When we are and coaches need to create an environment in that people are encouraged to be honest and allowed to, not like push to hide symptoms or whatnot. I don't think it's reasonable to have like kids socially distance when they're playing a sport. If that's what we're requiring, then we shouldn't be allowing them to play. And it may be somewhat more controversial, but I think the same goes for masks. Like, I don't think it's reasonable to ask kids to wear a mask while playing soccer, football, or other sports like that. But I think when they're off the field, wearing a mask is reasonable. I think requiring coaches and referees and other officials and staff to wear a mask is reasonable. Obviously, hand washing is really important, as is making sure nobody's sharing water bottles or towels or snacks or things like that.
Okay, great. So one of the things too for a lot of the kids, and my kids in particular, I know have been sitting around for a long time. There hasn't been organized sports, and we've had a lot of screen time. So what should kids and parents be thinking about as kids return to maybe more physical activity than they've been used to in the last few months in terms of just injury prevention? And frankly, think about that too for adults, as we might starting to be getting off the couch now that we're able to get outside a little bit more. But what are some of the things that parents should be thinking about to prevent injury as kids are being more active for the first time in some cases in many months?
I think it would be dangerous to, at any time, but especially coming off months where I would assume kids have been less active than usual, to let them like just jump full back into competition like it was before. So having some sort of period where athletes are allowed to get into shape and condition and work on skills to make sure they're ready to play is important, both in terms of just mental and physical preparedness and also injury prevention. In some of the like professional sports league, we've seen increased rates of injuries as they've gotten back to competition. So I think we need to take those lessons learned and apply it to our youth athletes as well. So I'd say in general, don't jump right into games. Make sure there's time to practice and get into shape, and really focus on that foundational work to make sure that kids are ready. And that's stuff that hopefully the kids are able to work on now, even if it's on their own, like just at home or on their own or in small groups. To, professional athletes don't jump right into games. They have a preseason and spring training, what have you. So I think we should take a similar approach to youth athletes.
Yeah, I think we actually got a question that's kind of a little bit on this topic, but it related to the safety with COVID. And I think you and I, Justin, before this had exchanged some comments about about the culture of sports. So we are starting to hear about and seeing the travel teams coming back together. And I'm actually hearing about travel tournaments starting up in Pennsylvania and teams traveling. I actually heard about an outbreak of COVID related to a travel softball team locally that had happened last week. What talk about this sort of some of the safety concerns around travel teams now, especially when they may be going back and forth with different states, and some of the teams are setting up temp checking. Is temperature checking, should that be part of these team sports? And what if anything can we do or can we not do that might protect the safety of transmitting COVID in the setting of that type of sport activity?
Yeah, I guess the short answer to the travel team question is I think travel tournaments are not a good idea at this time, and that we should be focusing on local, competition. Ideally, like one team at a time. Just as soon as you're bringing more teams than you need to together, that increases a risk of potential spread of infection. So I think definitely local is better. In terms of the temp checking, so yeah, I think as we've learned about this virus, you don't need to have symptoms or have a temperature to have it and be infectious. So obviously we can't rely on temperature alone or even symptoms alone, and that's why you need to have these policies in place. But I think as part of the screening protocol, temperature checks are important. It's an objective piece of data that can be fit into the puzzle. So I would say, yes, we should be checking temperatures, but that's not the only thing we should be doing. We should be checking symptoms and also having systems in place that in case people are infectious, it limits the chance of spread.
Okay, great. I think the tough thing with the travel team is for those families and children that are involved, it's during their season and sometimes year round, it's kind of their life. It's their second family. It's a big part of their culture. So what are some ways that you've seen that, kids who do participate in travel and that's their second family, that they can stay connected? What are some kind of ways for kids to stay connected with those friends that maybe you don't live in their same town, but they're gathering together in the past and they're not able to do that now?
So hopefully they could still practice, and just find other opportunities to play that aren't these big multi-state tournaments. So, obviously the competition would look different than normal years. But yeah, as I said, I think the risk of going to these large tournaments is not worth the reward. And that in terms of the joy of competition and training and getting better, honestly, there's more time to do that stuff when you're not traveling and schlepping around to different states and tournaments. So it might be a time to really focus on your team and your own skills and still be able to play teams locally. That's, I think, a potential option.
Yeah, I know we always say, when I was, I'm a little bit older than you, but I think everyone always talks about, when they were kids, we didn't have travel to this degree. We played one sport each season and it was so much different, and it obviously has evolved to the culture of what we have now. And I agree, it is a risk. There's it not necessarily the highest risk thing you can do, but getting together with teams from around the country certainly, and traveling in ways is certainly riskier than it used to be. So I've one off the cuff question. So it's a year from now, and things are back to normal, and sports have been gone. Professional sports, college sports, sports you watch on TV have been gone for a year, and now they're back. What's the first what's the first game and sport that you want to see in person or on TV that you're excited to see back again the way it used to be?
Oh man, yeah, I can't wait for that day. I guess in terms of something to watch on TV, and I know we share in common a love of college basketball, so I'd love to be sitting down as I plan to, like the week before this all started, to the first round of March Madness in mid-March, and take a few days off work and just watch all the games. In terms of an in-person experience, I'd rather be maybe across town from where you are at Citi Field, taking in, maybe it will make it a Subway series. So taking in the Mets and the Yankees in the stadium would be pretty cool.
All right, we'll go there together, and we'll share a beverage together.
Sounds good.
So, all right, good answer. I agree on both. So hopefully we'll be there soon. Justin, we've had some. It hasn't been that common, but we've had some teens and kids who've had COVID, and who have recovered or had sort of even an uneventful illness. Are there any precautions that should be taken for kids who are returning from COVID when they're thinking about going back to sports? And what's the current thinking about that issue for families and parents, and frankly for us as physicians to be thinking about?
It's a great question, a really interesting and emergent topic as we're kind of figuring out the effects of COVID-19. So there's been some recent guidelines in the past couple of weeks about exactly that, how to evaluate and testing that needs to be done for athletes who've recovered from COVID before they get back to their sport. The major concern is the cardiovascular effects of COVID-19, and we know that those can linger beyond kind of the resolution of symptoms. So the latest guidelines I've seen recommend if for any athlete who's had COVID and then returning to sports should be evaluated by a physician. That evaluation should include a good cardiovascular exam, and most recommendations are suggesting an EKG as well, the test that looks at the heart rhythm to screen for any potential abnormalities. For people who have been, those are for like people who were asymptomatic or mildly symptomatic. For people who were very sick and hospitalized, the recommendations include more testing, including an echocardiogram and a stress test and like a whole cardiology basically evaluation and workup. So at the very least, get a cardiologist on board if that were the case.
Yeah, I think for parents, if you're in that situation, obviously we would encourage you to reach out to your pediatrician or to Dr. Conway to help, kind of figure out what needs to be done in that setting. And, fortunately, most children that we've seen have had a mild illness. I think we're all aware of some of the very serious complications that fortunately have been quite rare. But I think as we move into the fall and think about, depending on where we are, that this certainly is a topic for us to all think about. So yeah, thanks for sharing that important topic. We did have a parent that just asked a general question. I think we sort of covered it already. And I guess if you're getting this question from a parent, how would you answer this? And kind of touches on the same topic, but just in general, is it safe for my 15-year-old to go back to playing on his team? A very general question, but yeah. We kind of covered. How do you answer that question?
So I guess it depends, but in general, I think from where we are now in New York State, thankfully, and from my point of view, I think most outdoor sports could be played with a relatively low risk or an acceptably low risk, I guess, of an outbreak. But that may change if our if the rates go up, obviously, again, there's, some risk stratification, but I think that, as you said on the outset, kind of having a threshold of when schools, like of that 5% threshold of testing, positive test rates for schools is also helpful for sports. I think that kind of in a way they go hand in hand. I would also say, yeah, if the student is already like back in school and congregating with the same people that they'd also be playing sports with, kind of the risk is already there. So why not let them run around and play with their friends if they're already going to be in school together? Because most of the risk is already undertaken with just being together.
Yeah, and it's actually this topic we've covered a lot, which is it's kind of a similar question as to whether or not it's safe to socialize. And as we've mentioned on some of these episodes before, and I think the most important thing to look at is what's going on in the community, as you mentioned, Justin. And right now we're in a period where it's pretty low. That could change, so it's important for all of us to be aware of what's going on with that. And then after that, as pediatricians and in your role as well, Justin, I think a lot of it is about modifying risk. And, the least risky things are outside, socially distanced. Next to that is outside with some protections. And then, as we start to move indoors, getting close together without masks on, it's highest risk, which is why, unfortunately, basketball is, right now in kind of a high risk indoor, even volleyball I saw on the risk stratification is high risk, not because of the close togetherness, but because it's indoors, everyone's touching the same ball. They may be sweating, there may be some contagion that way. So I think a lot of this is about both the risk of the activity and the risk of what we're seeing in the community. So we actually got a couple more questions. So one question is, how do you feel about indoor swim season? Another sport that
it's interesting because from what we know, the virus doesn't spread well in water, but like once you get out of the pool, that's seems like a high risk area for viral spread. And I know there's not a whole lot of outdoor pools around to house all the swim teams. So yeah, I think we have right now I would avoid it, but hopefully, when this winter, when swim season comes, or late fall, if over the next with the fall season, if things go well, then maybe that changes. But I think right now I would wait longer.
A lot of the swim clubs start up even as early as September outside of school. So
yeah,
I know that's and many of those are swimming in the summer. In fact, one of the parents had asked me about their swim team was doing dry land sessions with encouraging the kids to wear masks, which I know you covered earlier. As far as we don't think that that's really a great option. We'd rather keep people separated.
One other thing that I thought of that we didn't talk about yet is in terms of locker room. So even the NBA, their athletes are coming from the hotel in their jerseys, ready to play. So I think we can definitely follow in that we should not be opening locker rooms anytime soon, and just come in your whatever you're going to be playing in or practicing in, and then get in your car in sweaty clothes and then go home and shower. But that's certainly a big risk factor that we don't need to take on.
Yeah, I think one of the challenges to think about with youth sports is you look at what's going on with the professional sports and all of the measures that they're taking to create their bubble. In fact, the NBA was getting some heat this past week because I forget which NBA player posted something on his Twitter account that it was his 30th COVID test, and there's a shortage of test supplies in the state for all the people that are unfortunately that are sick. So a lot of the professional sports are creating these environments where they're hoping to basically have a self-contained bubble, and those aren't really replicable for us in our community. What professional sport do you think is doing it best so far? If we had unlimited resources to replicate, who's most likely to be successful at having their season?
Well, in terms of the team sports, Um, I mean, I think that so in Europe, soccer has like the German Bundesliga soccer league started up, I think in April or May, and it's been 2 months and they've been okay, and then the other leagues have followed suit. So that's certainly a model to look at. I think in the States, the NBA bubble is obviously like an extreme model that could not be replicated in almost like in any capacity locally. But I think that that certainly eliminates a lot of risk if you just don't let people in or out. But obviously, that's not feasible.
Yeah, I think that the sports teams, the local youth teams that are trying to use clinical screening are trying to replicate that in some way, but we just unfortunately don't have the resources to test all of those kids nor put them all in a bubble. Obviously, New York State seems to be trying to create our own bubble by limiting folks coming in and out, and that's obviously not going to create the full safety that we would like. But it is interesting to see the professional sports setting up these processes, and to the extent that we can try to replicate some of them, I think it gives us at least some protection and safety. Another question that came in, I'll read it to you. I'm not 100% sure I understand, but I think I got the gist. And maybe if this parent wants to just provide a clarification, that would be fine. So the question is, what are your thoughts on preseason fitness tests and their sympathetic response after this whole time off? I think it's getting at the question that we talked about earlier, if you haven't exercised in a while. But I think what it's getting at, and I'm sure you know that for some kids, they have to do a physical fitness test if they're looking to play up to a higher level. For example, an 8th grader playing varsity. I think that's what they were getting at. And the parent just replied back again that they were looking about their nervous system response. So I don't know, maybe you can just talk about kind of, what to do if your child is faced with having to do a preseason fitness test as part of their sport, and how to best navigate that.
Yeah, I think those, definitely familiar with those tests, and that a lot of athletes have those requirements. And I think in general, it's something that we need to be, or we should, and coaches should be careful about, because, especially in the summer, there's a relatively high risk of heat illness, and kids can get really sick if they're pushed too hard too soon. So now, like any other time, I would, make sure that kids are given the chance to condition up to the fitness test, and aren't just like thrown from inactivity to do this like test to exhaustion, because that's, definitely can cause problems. Particularly, if like post-COVID, whether they know it or not, I would be concerned too that there'd be a higher risk of heat illness and heat exhaustion and things like that. So I think we definitely need to be careful.
Okay, great. So Justin, one thing that I'd like to just ask, and if there's any other questions, we'll be happy to take them. But one thing I'd like to just sort of close with as we get ready to finish the show today is, what's your best advice to parents and children for maintaining resilience during this challenging time, especially as we are seeing and are concerned that we're still in the midst of this pandemic locally?
Yeah, I think that my answer would be to stay active, find a way to stay active. And, that's certainly been helpful for me to stay resilient and to stay sane throughout this time. So if it's even if it doesn't look the same as how you normally are active, in terms of team sports and things like that, finding a way to whether it be outside or inside, get moving, get your heart going, throw some weight around, depending on your age, and just enjoy the physical and mental benefits that come with that. As we're experiencing here, there's lots of virtual ways to connect. I know a lot of teams are, having virtual workouts. So just exploring ways and getting creative to stay active, I think, would be my advice.
Great. And what's your go-to activity that you've been doing besides chasing your children?
Yeah, that's probably number one. Yeah, I mean, I've been running a fair amount. Thankfully, there's some good running trails around where I live. And then we have a stationary bike, which is a good thing to do to clear the head. How about you?
Well, I'm finding without any races scheduled, it's hard. It's been hard to motivate. So
Hmm.
maybe I'll throw this out here. This is the first time I was telling this to our marketing team. I'm thinking about having a race day in the fall. That's just like you do your own race. I'm
Hmm.
going to call it the You Do You race. So you can pick
Nice.
any distance, but we just have a weekend that we put on the calendar, and people that want to train, that they know they're sort of accountable to each other. Because what I've been finding is it's just hard to. I like to run. I ran some races last year that I was really excited about. But just without having something on the calendar, it's been hard for me to motivate. So thinking about throwing down a date and encouraging people here at Crystal Run to, if they're interested in just having a day on the calendar that they'll train for, that we can all kind of have something to work on. So that's kind of how I've been thinking about it. But yeah, I agree with you. Staying active has really been important. And fortunately, at least right now, the weather is nice enough to be doing that
Yeah.
outside. So great. Thank you guys for joining from home. Thanks to Dr. Conway again. I want to just thank Dr. Conway for one other thing, which I'll embarrass him about, but some of you may not know this. But so Dr. Conway is an amazing sports medicine physician with us. But one of the things that happened at Crystal Run during the COVID pandemic was that a number of our physicians had stepped forward to take on new roles across the organization at local hospitals. And when we sort of asked people to do that, the very first person that volunteered was Dr. Conway. And not only did he help us out at one of the local hospitals at St. Luke's, where I had actually the pleasure of working with him for a few days, putting on an old skill set of a hospitalist. He also went down to Mount Sinai to his former training program and helped them during a really challenging time. So I was amazed by that. I appreciated Dr. Conway's help, and certainly the community thanks him for that as well. So I just wanted to thank you again for doing that for us.
Thank you
And
for
I hope you never have to do it again. But
that makes two of us.
we'll be prepared, I think, more the next time. So that
Yeah.
was hard to believe. That was already, almost 4 months ago.
Yeah.
So just in closing, again, thanks, Dr. Conway. For the folks out there, this is our last scheduled session. We appreciate everybody attending. These are available for viewing, sharing. We are probably going to have one more session or have an additional session in August about returning to school. I know that's a common question we've been getting. The school guidance has just come out, and the school districts are now going to be forced to kind of come up with their plan. So once we see that those plans are in place, we'll have another planned session. So look for that. Be happy to sort of take some questions about that at that time. But also, if you have questions before then about sports, about returning to school, or just in general about anything, reach out, ask your pediatrician, ask your sports medicine physician. We're here at Crystal Run. We've missed you. This is the kind of the big time of year for physicals, so we're seeing a lot of you back again. It's great to see everyone. As you know, we've set up many different safety measures so that we can see you safely in the office. But we are also available, and I'm sure Dr. Conway is too, to do visits via video and telehealth. That's been a great modality for us to stay connected with you. Dr. Conway, just remind everyone what offices you're located in, and then also, and if you could just validate that you're doing telehealth as well, and what kind of things you've been seeing with that visit type.
So I'm in person. I see patients in Newburgh and in Monroe, and I see patients via telehealth wherever you may be. Yeah, I've enjoyed the telehealth and definitely plan on continuing it. I think it can be good for both initial evaluations or follow-ups, especially like after you've had imaging or really anything. So I don't think you can go wrong with telehealth. Sometimes we may ask you to come into the office after that, but it's never a bad place to start.
Great. Well, thanks again, Dr. Conway. For everyone listening, please stay safe, be kind to each other, wear your masks, and we hope to see you guys back for another session in the near future. And thanks again, and have a great night.
Thanks, everybody.